Hello, Otterbein residents, family, and friends. Kendra with you today on this gorgeous day. How fortunate are we that we've had some really great weather over the last few days, and I think it's going to continue, which is good news. I haven't brought a video update to you in a few weeks, so I thought this was a great day to do that. What I'm very happy to share with you is I'm not coming to you today to alert you of any positive COVID-19 cases. So that's great news. Our numbers are at the same where they were a few weeks ago, we've had 13 positive resident cases, 3 partners, and 3 contractors, all of whom have recovered and are doing well. So that's great news. What I do want to share with you regarding testing, I always like to give you an update on testing. So if you recall the Otterbein offensive, we started aggressively testing back in the middle of April, which I think was a very wise decision, and I think has helped keep us safe. And then a few weeks ago, Governor DeWine ordered that all nursing home employees are to be tested every 2 weeks, which we began that as well. Just this past Monday, CMS, which is the Centers for Medicare and Medicaid, came out with new testing protocols that follow certain guidelines. So Warren County just recently jumped over 10% for the number of positive cases in the county. So per those CMS guidelines, what that means is we now have to test our partners twice a week. That's correct, twice a week. So it's a lot, but I'm very appreciative that our partners have been great, very agreeable, because like all of you, they want to keep everyone safe. Should Warren County drop between 5 and 10%, then we go to testing just once a week. And then if we go under 5%, then we go back to the governor's order of testing every 2 weeks. That is, of course, unless we get a positive case, then we will increase that testing, but let's hope that doesn't happen. So I wanted you to just be aware of that kind of the testing protocols that we're following right now. This also, in case you see, if you happen to come in, maybe you're going to the Y or you're going to the Mona Lisa salon, all of our partners that work in any of our healthcare areas or assisted living, everyone now must be in a surgical mask. And you may ask, well, why is that different? All of our direct caregivers have been in surgical masks, but this is anyone, anyone walking into any of the neighborhoods, myself included, will be in a surgical mask and now goggles or a full face shield. And we will do that while the county still sits at that percentage, slightly over 10%. So I wanted to make you aware of that as well. I do want to give you a couple fun updates. Let's move away a little bit from testing and COVID-19. We have opened many things up, which I think has been so great for everyone. The next big thing I'm working on is in-person church service, worship. I've been working very closely with Pastor Tom. I don't know if all of you have had a chance to meet Tom. He's been so great to work with. And what he and I are doing is we're just trying to put a plan together to bring people back inside into church, but also do that in a safe manner. So we have to look at social distancing. Masks will be required. Most likely, there will not be a choir initially. So we're just trying to figure all of that out. Actually, Pastor Tom and I just met this week, and we are looking to make that happen in around mid to late October. So please look for something about that to come as well. I do want to give a big shout out to Rhonda and programming, and Jill and Sue Suskind. I think they've done a really great job recently with trying to bring the fun on campus. We had zip lining, we had axe throwing, she's had multiple food trucks, and I do think she has something pretty special planned for Oktoberfest, so keep your eye out for that as well. We continue outdoor visits. So for healthcare, just so you know remind you what that looks like, family members are allowed to come visit outside. Again, everybody's in masks, social distancing, but it's a little bit nicer than a window visit. The same for assisted living. Those residents living in the Aurora can visit with their family members outside, again, social distancing in masks. And independent living, that not much has changed there. You know, your family may come on campus and walk campus with you, but we again ask that you follow all of the same guidelines of mask and social distancing. We continue to operate the Koi Cafe, which is actually where I am right now. So I want to give a shout out to Drew and his team. I think this was a fabulous idea they came up with. If you haven't been down here, please come down here. I know Drew and myself included, we're going to keep this open as long as we can until the weather allows us not to do so. And I'm sorry, and let me quickly go back to visits. I do want to add, I've received a lot of questions about just that. What about when the weather changes and it starts to get cold and colder? We're working on that. That's what I can tell you as of today. I am working with the team here and of course our home office team on what does that look like. I'll be honest with you, it makes me slightly nervous because we've done such a great job here of keeping everyone safe. And you know, the more you open things up, you become a little more at risk. But I also know, you know, it's how important it is, right, to be with your loved ones and your family, and especially not only as it gets colder, but we roll into Thanksgiving and Christmas and holidays that will be here before we know it. So stay tuned on that. We're trying to figure out what exactly that will look like, but more information will come on that. I do want to quickly just, I guess, give a public service announcement if I can. I've had several residents reach out to me that they've received phone calls that are scams. People in some way or another trying to get you to send them money, help them out. They usually give you a desperate plea. Sometimes they may even say, oh, your grandson needs money. And I know Kevin has had something out on the OLN, a slide out there, just kind of keeping that on your radar. But it really seems to have ticked up, especially here with COVID-19. Maybe people are feeling a little more vulnerable. So please be aware that, you know, if you do not know the person, you don't ever give your social security number, your address, your phone number, unless you are 100% sure of who the person is or who the organization is. Please do not send or do anything, especially financially. I would advise you just to hang up on them. And I will finally add to that, you know, also be careful because they've become very savvy with phone numbers. So if you have, say, a caller ID, they may use the first three numbers of a 513 or a 696, a number that you think, oh, that must be someone here on campus or someone I know. That's not always true. So please be very mindful of that. And then I also, going back, I want to give another shout out to Sue Suskind. She has brought back new resident orientation in a modified way. But, you know, we did hit the pause button on that at the beginning of COVID. So for all of you new residents who maybe moved in February or March and since then, I apologize for that. But Sue has brought that back. We actually had it today out here at the Koi Cafe, which is where she's been holding it, and it's been really well received. So I do thank Sue for that. And if you haven't attended yet, please get yourself signed up. And finally, I want to talk about the Surrey, which is going to act as our shuttle service for right now. The Surrey, I think in my last video, Kevin put up a nice little description of what the Surrey is. And I apologize, we were hoping to get the Surrey out and about a couple weeks ago, but when we started running it around campus, we realized that the battery wasn't keeping a charge. So then we had to purchase new batteries, then we ended up having to get new tires, because it's actually kind of a large piece of equipment. But I'm happy to say that the Surrey is up and running, it's got a lot of power. Michael is going to be the one to initially drive it. If you have not already, you're going to be receiving a letter from me. Just kind of going over some of the details around the Surrey. You will call the front desk to schedule. We initially will have limited times and days. I do want you to know that. We're going to see how it goes at first, and then we'll probably open it up to more times and days if it all works out. We do hope to bring the van back. I want you to know that, but we're just not quite there yet on how we keep the van safe and sanitized. And also, remember, the van was driven by many of you probably watching this, our resident volunteers, and we need to figure out what that looks like as well to keep all of you safe. So the Surrey will start running Monday. There will be no standing appointments, so you'll need to call and make your appointments, whether again you're going to the salon or you need to ride up to the YMCA, anywhere you may be coming up to campus. So again, look for that letter coming from me if you have not seen it already. Other than that, those are my updates for today. Just as I always like to do, my friendly reminders to wear your face mask, socially distance. If you're with someone that you don't live in the same household, wash your hands frequently. And I hope you all are doing well, and I really, really hope that you are able to enjoy this gorgeous weather that we've been having. So have a great day, and I hope to see you soon.